Hello. My name is Maddie Brown. I'm going to be your nurse, your student nurse today. Can you please tell me your name and date of birth?
Alyssa Rambawa, June 4, 2001.
Okay. Are you feeling any pain or discomfort?
No.
Okay. So we're going to be I'm going to be examining your head, neck, ears, eyes, nose, mouth, and I'm going to be assessing your motor and sensory function. Do you have any questions?
No.
Okay. So first thing, I'm just going to be asking you a few questions. You can sit up for me if you want, and you can dangle your legs over. So, do you know how you got here today?
I walked here.
Okay, and do you know today's date?
February 18, 2021.
And then do you know who our president is?
Joe Biden.
Okay. Next thing, I'm just gonna say a series of words, and I would like you to repeat them back to me. 3, 21, 47.
3, 21, 47.
And then can you repeat them backwards?
47, 21, 3.
So you seem awake, alert, aware. Your memory is there. Your attention is there. So all those are good findings. So next, we're just gonna get straight into the head examination. So first, I'm just gonna be palpating your scalp and your bone configuration, your hair. I'm just looking for any masses, any lumps, infestations, anything like that. Hair distribution looks even. I don't see any patchiness, no lumps. Are you feeling any tenderness at all? Okay. Your skull size is proportional according to your body. So all those are normal findings. Next, I'm just going to be palpating your sinus regions. So I'm going to be feeling the maxillary sinuses and the frontal sinuses. Do you feel any tenderness?
No.
Okay, so they feel smooth. No swelling at all, nothing like that. So now I'm going to be feeling your jaw. Can you open and close your mouth? One more time. I'm checking for clicking and popping, and I do feel that. Have you been told that before?
Yes.
Okay, so I'll just take a note of that. Next, I'm going to be assessing cranial nerve 5 for facial sensation. So I'm just going to be poking your face with 3 different sensations: dull, soft, and sharp. And I want you to tell me which sensation you feel and in what location on your face you feel it, okay? So if you could just close your eyes for me.
Dull. Sharp. Soft. Soft. Dull. Sharp.
Okay, so all those were good responses. So your cranial nerve 5 is intact. Now we're gonna do cranial nerve 7, which assesses your facial expression and facial symmetry. So if you could just puff out your cheeks and raise your eyebrows and then squeeze your eyes shut. So all your facial expressions were symmetric. So your cranial nerve 7 is intact as well. So now we are going to move on to the neck. So I'm just going to be palpating all of your lymph nodes. The preauricular region, the posterior auricular region, tonsillar, submandibular, submental, superficial cervical. Are you feeling any tenderness at all?
No.
Deep cervical, posterior cervical, occipital, and supraclavicular. You don't feel any tenderness?
No.
Okay, so I didn't feel any abnormalities. All of them were smooth and normal temperature, anything like that. So now I'm just going to be checking the the trachea. I'm looking to see, so it is midline. Now I'm just gonna ask if you can turn your head this way and this way. So your breathing is relaxed and I don't see any bulges to see any venous jugular distension, which is a normal finding. Now I'm gonna be palpating your carotid pulse. So I feel that there. Now I'm gonna check the other side. So your carotid pulses are symmetric. I rate that a 2+, as expected. Now I'm gonna be listening to them for any bruits or whooshing sounds. So if you could just hold your breath. Okay, so that feels normal. I didn't hear any bruits, which would indicate turbulence due to narrowing. So now I'm just gonna be assessing cranial nerve 11. So I'm just gonna ask if you can shrug your shoulders up against my resistance and then turn your head. So I feel, and then we'll do behind and then in front. So I feel good strength on all those, so your cranial nerve 11 is intact. So now we're gonna move on to the eyes, and I'm just gonna be palpating your lid. If you could just lay back down for me for a second. I need to do some hand hygiene before I touch your eyes. Do you have any questions so far?
No.
You can go ahead and swing your legs back. I'm gonna take this off because I touched the bed. Okay, so I'm just gonna be palpating here. So I don't feel any masses, protrusions. I don't see any edema or drainage. Also, I'm just gonna be pulling down your eyes. The conjunctiva look pink and moist, which is a good sign. If you could just look at me. Your pupils look round and equal. The sclera looks white. Your eyelash distribution is even, which is normal. So now I'm going to be testing cranial nerve 2, which is your peripheral vision. So if you could just cover one eye, and I'm going to be testing your 4 visual fields. So just tell me when you see my pen light come in your vision.
I see it. I see it. I see it. I see it.
Okay, now do the other eye. So superior, temporal, nasal, and inferior.
I see it.
Okay, so all your 4 visual fields were even. So now we're going to test cranial nerve 4 and 6 with the 6 cardinal directions. I want to see your eye movement. So if you could just look straight ahead, or keep your eye or your head straight, and then follow my pen light in 6 directions. Okay, so your eye movements were focused even, so it indicated that your cranial nerve your cranial nerves 4 and 6 were intact. Now we're going to test the corneal light reflex. So I just want you to look straight ahead. I'm checking to see if the speck is even in both your eyes, which it is, which is a good sign. Now I'm going to be inspecting the corneal reflex, which tests cranial nerve 5. So if you could just look this way. Okay, and there is brisk blinking. Okay, so there's brisk blinking on both eyes, which is a good corneal reflex. Now we're going to be assessing cranial nerve 3 with the pupillary reflexes. So I'm going to be shining this light in one of your eyes to check direct and consensual pupillary reflexes, and I see that both your pupils constrict under light and dark. So now I'm going to be also assessing cranial nerve 3 with an approaching object, so for accommodation. So if you just focus on my pen light and back, we'll do it one more time. Okay, so I see that your pupils constrict with the approaching object, which indicates a good cranial nerve 3 there. Now we're going to be assessing your red light reflex with cranial nerve 2. So if you could just lay back down for a second as I go get the oscilloscope. Okay, you can sit back up. Sorry for all the movement, I just don't want you to fall. Okay, so if you could just look over my shoulder. Let me just go back to... Okay, so I'm just going to be taking this off for a second so I can assess your eye properly. Okay. So I do see the red light reflex. Now I'm going to move in closer. I'm going to put my hand on your shoulder. And I see the whitish optic disc. The macular area is darkish. I see the glowy amber retina color. See some veins and arteries. So that looks normal. Now I'm going to be doing the other side. Okay, so if you could just look straight ahead. Okay, so I see the red light reflex there. And I see the same structures, the macular area, the color of the retina, veins, arteries, optic disc, all look normal. So that looks normal. Now we're going to move on to the ears. So I'm just going to be palpating your external ear, checking for any nodules, looking at the helix, the lobe, tragus. Do you feel any tenderness at all? Okay. Now I'm going to be doing 3 different tests that test your cranial nerve 8 for hearing. So the first one, I'm just gonna ask if you can actually turn this way, turn facing the wall. Lower the bed because I have to go a few feet behind you. Okay, so I'm just gonna be whispering a couple of words, and you tell me if you can hear me. If you could just occlude your right ear and kind of muffle it, like, there you go. So I'm just gonna be whispering a few words and you repeat them back to me.
Starbucks. Trash can.
Okay, and then if you could do the same to the other ear.
Coma.
Swimming.
Oh, swimming?
Okay, let me try again.
Hair.
Yes.
Okay.
Let me try one more word.
64.
Okay. So your hearing there seems normal, so you can turn back around.
Is it swimming? Is it cold? Okay.
So the next test, this is also going to be assessing cranial nerve 8. We're going to be doing the Weber test. So I'm going to strike this to the side. And of this, I'm going to place it on the top of your head. I just want you to tell me if you can hear the ringing evenly in both ears.
Hear it on both sides.
Okay, great. Now we're going to be doing the rind test. So I'm going to strike the same thing, and I'm going to be placing it on the back of your ear, the mastoid bone, and then when you tell me you can't hear it any longer, I'm going to be placing it right next to your ear, and you tell me when you can no longer hear it. Okay.
Time. Time.
Okay, so we're going to test the other ear as well. Your bone conduction was a lot longer than your air conduction, which might indicate some hearing loss, but we'll check the other one first. So if you could just turn that way for me.
Time. Time.
Okay. So your air conduction in this ear was twice as long as your bone conduction, which is normal findings. But your left ear might indicate some conductive hearing loss. Have you been around like any loud noises or like listening to your music too loud, something like that?
No. Sometimes I might hear some ringing, which is something else, but.
Okay, so I'll just take note of that for you. So the next thing we're going to do is do an otoscopic exam on your ear. So if you could just scoot over this way. Okay, and then you could just look that way for me. So let me know if you feel any discomfort. I'm gonna take this off once again to inspect properly. So I do see the tympanic membrane. It's pearly gray. I see some veins. I see a little bit of cerumen. That's normal. I see a nice pink color. I'm gonna move on into the other ear. Let me know if you feel any discomfort at all. Okay, so I also see the tympanic membrane, pearly gray. I see some cerumen, even hair distribution. This one's a little less pink of a color than the other ear. Overall normal findings. So now that completes the exam for the ear. So now I'm just going to be moving on to the nose. Have you ever broken your nose or anything like that? Okay, so first thing I'm just going to ask you to occlude one nostril, breathe normally, and then do the other side. Normal, your breathing looks even. Now I'm just going to ask you to look up for me. I'm going to be inspecting your septum, which looks aligned. It's not deviated at all. Okay, that looks good. Now I'm going to be looking at your internal structures again with this. So I just want you to tell me if anything hurts when I go in. There we go. So I see a nice pink color, some veins, even hair distribution. Are you feeling any discomfort at all? Okay. Now I'm gonna do the other side. Even hair distribution, nice pink color, no excessive drainage, no edema that I see in either of your mid-nostrils. This one is a bit pinker than the other side. Okay, so that seems normal. Now we're going to be assessing your cranial nerve 1 for scent. So if you could just close your eyes. I'm going to be wafting a few scents under and you let me know what it smells like.
Raspberry.
Okay. The next one?
Peppermint.
Okay, so that's good. Now I'm going to be lastly assessing your mouth. If you could, I'm just going to be inspecting. Your lips look good, moisturized, not chapped or anything like that. And then I just would like you to open your mouth. I'm going to be assessing this. Okay, so I'm just looking at your gums, your teeth, they're intact and white. I don't see any, I don't see any lesions. Your mucosa looks moist. Can you stick out your tongue? So nice pink color, don't see any lesions. Okay, so I'm just gonna assess cranial nerves 9 and 10 at this point for the next 3 tests. So if you could open your mouth and say ah. Okay. And then I'm just gonna test your gag reflex really quick. Okay, so it doesn't look like you have a gag reflex, which is okay, some people don't have it. And then I'm just gonna ask if you can swallow and cough. Okay, so that's a good reflex. Next, I am going to be assessing cranial nerve 12 to see or cranial nerve 12 for your tongue movements. So if you could just stick out your tongue up and down and side to side. Okay, so that looks normal. Tongue movements, no deviations, anything like that. And then lastly, we're going to be assessing your taste for your tongue. So if you could just close your eyes, I'm going to be testing a few tastes. Okay, so first we're gonna do your anterior tongue. Can you stick it out, please?
Sour.
Okay. Okay, one more.
Sweet.
Mm-hmm. And lastly, this is the last one for anterior.
Salty.
Okay, now stick it out a little further.
Sour.
Okay.
Sweet.
Mm-hmm.
Salty.
Okay, so those are all normal findings, and you had good responses for all of them. The last thing I'm gonna do, I'm going to, I don't remember if I did this earlier, but I'm just gonna do it one more time. Can you I'm gonna be palpating your thyroid. So I'd just like you to swallow. And then one more time. Okay, so your thyroid feels smooth and it moves up and down with your cricoid cartilage, so that's normal findings. So I think that's all for our examination. You can lay back down now. And then do you have any other questions at all?
No.
Okay, so the findings, you might have a little bit of conductive hearing loss in your left ear, no gag reflex, and you had a little bit of a click in your jaw, but other than that, everything is normal. So I'm just gonna lower the bed back down. And I think that concludes our examination. Do you have any other questions?
Nope.
Okay. So I hope you have a good day. If you have any other questions or need anything, the call bell is within your reach. Have a nice day.